Good evening, everyone. My name is Ritha Pierre, and I am the founder of Black Ivy Media, a platform that seeks to change the narrative of the Black diaspora in one conversation. I will be your moderator for this evening, and I am honored to welcome you all to a very informative panel discussion. I know you guys are going to get so much out of this. We are going to be talking about Black maternal health. We want you all to be part of the conversation. And if you are tuning in via Facebook Live or YouTube and you want to ask a question, please do so. Put your question in the chat and I will hopefully get to it before the end of this evening. The goal for tonight's conversation is to raise awareness on Black maternal health and to provide you all with strategies and solutions that can empower you to be better advocates for yourself, your loved ones before, during, and after pregnancy. Here to help us navigate the world of Black maternity are my esteemed panelists, Dr. Linda Burke, a board-certified OBGYN physician with over 3 decades of experience, Tamar Innocent, a women's health coach and a full-spectrum doula, and last but not least, Shawnee Benton Gibson, CEO of Spirit of a Woman Leadership Development Institute and a Black maternal health advocate. Thank you so much for being here, ladies, and welcome everyone to this conversation on Black maternal health.
Thank you.
I'm very happy to be here.
So Black maternal health, it's a critical issue and many have deemed it a public health crisis. But I like to define terms before I start anything. And this question can go to anyone. What exactly is Black maternal health?
I would define it as the health status of a pregnant woman. I mean, in the most simplistic terms.
Okay.
How I view it is just like any other woman, the time during pregnancy or the time during childbirth and then the postnatal period for women, but we're talking about Black women, the women who identify as Black, and the outcomes that they experience that are different than their white counterparts.
Okay. Tamar, do you have anything you would like to add to that?
No, I completely agree. Just the fact that Shawnee added, it's about Black women and how I guess this status had to be added, right? Because at one point we were just saying probably, I don't know when, but we were saying maternal health, but Black maternal health has become of utmost importance.
Okay. And so as we're talking about the Black part of it, right? Because I have been seeing a lot of posts around just maternal health in general, right? Because that is still an issue. You know, living in America, the statistics are alarming at the rate of women who die with pregnancy-related deaths in the United States. But now we're talking about Black women, right? And so I want to just talk about an incident that took place a couple of years ago. I think many of you might be familiar with it. It was with regarding Serena Williams. And so many might remember Serena Williams during her pregnancy. She suffered a life-threatening pulmonary embolism in her lungs. And the story goes is that she requested assistance from a nurse who suggested that maybe she was confused from her medication. And after insisting on more tests to be run, they found the embolism. Serena also had ruptured her C-section incision while coughing. And in going for the repair, doctors found a hemorrhage. And so had it not been for her rupturing her incision, she could have died. And this incident with Serena Williams is not isolated. We hear about situations like this happening time and time again. And so my question is, why are Black women so ignored when it comes to, the symptoms and the ailments that they're experiencing? Like when they're trying to express their concern about an issue, why are they ignored?
I will share from a historical framework, especially in this country, but it also happens abroad. due to the scourge of the enslavement of Black people and brown people as well, or the subjugation of brown people. There is a narrative that exists that Black women are more likely to be able to manage pain, that we're less believable, that our bodies are structured differently, and that we function differently as it relates to pain than our white counterparts. And as a result of implicit and explicit bias and racial injustice and prejudice, and sometimes for these systems in the United States, outright racism or structural racism, Black women are subjected to treatment and made invisible in reference to their needs. And so we get the outcomes that we get, not just around pregnancy, but in other areas that involve our health.
So I want to swing back for a minute to talk about Serena. And Shani, I concur, I thoroughly agree. But let me talk about this from the space that I'm in, which is a Black woman who's an OBGYN physician. What you're dealing with is, in addition to racism, you are dealing with a healthcare system that has become a business. It is monetized now. The reason that Serena was able to save her life was because, number one, she had exposure to her condition before. She was well versed with her body. The second thing that saved her was, and this is what I want to teach us, she was able to articulate her needs, to talk about her needs in the language that these folks understood. When she started talking about the things that the diagnostic tests that she needed, such as the CT scan, VQ, et cetera, then everybody paused because they then knew, okay, maybe we better listen to her. And it's a sad state of affairs that we have to do that. But this is where we are now.
And Tamar, I know as being a doula, you deal with pregnancy at different stages. What are your thoughts on incidences like this?
I think Dr. Burke hit it on the nail because, I go into meeting with clients, and even when teaching childbirth education, giving them the right language, teaching them the differences between dialogue and discussion, and knowing how to advocate for themselves, knowing what tests to ask for, knowing, what to expect at this prenatal or what to expect at your postpartum appointment, like arming them with that knowledge and that education is like the best weapon you could ever give a Black woman. Yeah.
Okay. So now we hear a lot about, the leading causes of just maternal mortality, right? But again, trying to bring it back to Black maternal health. Dr. Brooke, what would you say are some of the leading causes of maternal deaths in Black women?
So the first problem is the misdiagnosis of our conditions. By the time that folks realize what's going on, the problem has exceeded the treatment. So number one, people do not know how to recognize clinical problems. And this is what, one of the reasons why I advocate that Black women know your risk factors. Hypertension, diabetes, these are conditions that often go undiagnosed. And so when a woman becomes pregnant, quite often it's the first time that she is seeing a physician, or a healthcare provider. Because, let's just be real. Black women work, we work, sometimes we work 2 jobs. And unfortunately, quite often we put our needs behind everyone else's. So these are the big problems in terms of maternal mortality. Excessive bleeding, misdiagnosis of preeclampsia, which then leads to a stroke, and quite often death. And I'm going to try not to be emotional about preeclampsia, because it's horrifically misdiagnosed. Other issues are pulmonary embolism. Quite often women have shortness of breath. People blow them off, tell them, that's because you're pregnant. No, it's not. And they don't listen to the woman. And that's a big issue, especially Black women. So I'm gonna hit pause for a minute and let other people talk. But those are the big issues: the misdiagnosis, poor recognition, poor timing in terms of treatment, and wrong treatment.
Shani, I see you're nodding your head.
Yes. I would like to just go back and share that my daughter, Shamani, I'm just thinking about what Tamara and Dr. Linda just shared. She was very well versed in, the language. I've been in this work for 12 years. I've been a clinician for 30. So these were our conversations. She had a midwife. She had a doula. She was a dancer. She was very physical, very kinesthetic. So she was sedentary and not moving around. She was not overweight. She ate well. Just very present to her and always researching. So she had the language and the understanding of what was happening with her body, and still she died. So, sometimes I feel like Serena, what saved her was all that you declared, Dr. Linda, and then also who Serena was, and also the assertiveness that she brings to everything, like the game, and just when you hear her speak. And so she commands the space. And even inside of all of that, they still were like, oh, maybe you're, and she was able to make moves and get that done. Which get that done is save her own life. It's a shame. There are 5 main ones, and Dr. Linda covered them. I don't think we mentioned what is it, cardiomyopathy? The weakening of the heart as a result of being pregnant, and just that can take you out too as a pregnant woman. I've lost a couple of people who were in my life as a result of my work because of that condition as well. And then they overdo they do too much surgeries, the C-sections, and that makes you more susceptible. So my daughter had a C-section 13 days after the C-section. She died from a birth-related pulmonary embolism. So it's tragic, and it's definitely killing us. There are more near-death experiences actually than there are deaths. So we look at those statistics, they're alarming, they're staggering. And you talked about your emotions, Dr. Linda, like it hurts me to the core that women are doing the most natural thing, which is to bring new life into the world. And you have to worry about whether you're going to have such a traumatic experience that you'll be scarred for the rest of your life, figuratively, or that you may not make it home to raise your baby or babies and be with your mate if you have one, and be with your family and have a life. My daughter was only 30 years old, and it's just tragic because it was preventable.
Yeah. So I can't see either one of you, but we're just going to continue. But I want to offer publicly an apology to you, because we failed you. We failed you. We failed your daughter. We failed your grandkids. And that should not be. It should not be. But we are a resilient people.
We are.
And what doesn't take us out of this world makes us stronger. And women are extremely strong. And so we are determined that we are going to come up with ways to improve the situation. For example, and I think this is a very important fact. African Americans represent 13% of this country, according to the US Census. And yet only 5% of physicians in this country are Black or African American. And I'm sure in midwifery, the statistics are just as dismal. There is an organization that started online and has now moved to the public space called MOCA OBGYN Alliance. It's practically all of the African American OBGYN physicians and it's a female group. You know, these are Black female OBGYN physicians. And what we're going to do, because we keep hearing over and over again, where are you? You know, how do we find you? So we are in the midst of developing a database where you're going to be able to put your zip code in and find out where we are. And, you know, it's small steps eventually make big progress. So I just want to share that with you, because your daughter should be here and she's not. And I'm very sorry.
Thank you, Dr. Linda.
So Shawnee mentioned something with respect to C-sections, and how it seems as if Black women are receiving the highest amount of C-sections in the country. Now, why exactly is that? I mean, I myself, I was pregnant 14 years ago. My son's 14 now. And I had complications as well during my pregnancy, and I ended up having to do an emergency C-section at, I think it was 27, 28 weeks. But after that, I find that most of my friends who have had children have had C-sections. And many of them didn't necessarily have, at least they weren't aware that they had any real complications that would warrant them to have the C-section. So Dr. Burke, and also Tamara, I would like to get your input as a doula as well too. Why is it that we're seeing such an increase, like such a rise in C-sections?
Okay, so C-sections is a touchy subject for me. I don't. Let me start this way. There are standards of care, okay, that are supposed to be used in order for a C-section to be done. The rule is that you are not supposed to arbitrarily do a C-section. You are supposed to have clinical indications to do a section. Now, culturally, and please keep this in mind. Physicians that look like me only represent 5% of physicians in this country. And I can almost assure you with 100% that sisters who look like me will only do a section if it is clinically warranted. Other folks do things differently. I also want to say that the whole thing about performing an emergency C-section, it is about oxygenation to the baby, okay? The baby is not receiving oxygen. It is going to have a multitude of problems. So there are tools that we have, fetal monitor. If we see that the baby is being compromised, then the philosophy is remove the baby from a harmful environment, which is the uterus, which is not supporting the oxygenation of the baby. And that could be for a multitude of reasons. Under those conditions, a C-section is supposed to be done. Do folks do C-sections for other reasons because it's convenient? I'm not gonna lie and say no, okay? But I don't. And most people who look like me do not. But does it happen? Yes, it does. So how do you address this? Again, it's information. You look at what are the reasons that C-sections are supposed to be done, because ACOG, which is, the governing body of OBGYN, their whole push is to reduce the number of C-sections, not to promote an increase of C-sections. So I don't know if I answered your question.
No, I think you definitely did. And it's, again, I think the point that you're making, that is only 5% of the physician population is Black. I think that really, really plays a huge role in all of this. We're talking about, racism, implicit bias, and things of that nature, which it's sad, because I can count on, both of my hands, the amount of women who have endured at least some form of either bias or racism during their pregnancy journey. And unfortunately, some of us, have lifelong scars because of it. And at some point, it's like, where does it all end? How can we move forward? What can we do? And so I want to actually go to you, Tamar, with respect to what exactly is a doula. We're hearing more and more people talk about, midwifery and doula and things of that nature, but I kind of want to get an understanding of what exactly is a doula and how do they, fit in the grand scheme of talking about the birthing process.
In the easiest language, a doula is someone that provides labor support to a pregnant person, right? But with that becomes educate for, and I think for a Black doula, that's education, that's educational support, informational support, advocacy. And then you have, I know one of the things you want to talk about was postpartum. So you have doulas that stay with a mom, whether it be for a couple of hours a day or overnight, that they provide postpartum support to both the mom, to the whole family, really. But their focus is honestly the mom. I feel as if doulas have become kind of like the frontline workers of advocacy and making it loud and clear that Black women are dying. And I also feel like doulas kind of have this burden. There's this thing out there now, like, you need a doula, they're going to save your life. We can't save lives. We could only support families and educate them and be there with them and hold their hand and love on them and, just be and hold space for them. But I've found like so many people saying, girl, if you don't want to die, like, get a doula. And it's like, no, that's not what we do. We cannot save lives. We can help a situation and make it better, but we're not clinicians. We're definitely not God. So we can only do so much. Do we make a difference? I absolutely believe so. There is research on research that shows that doulas are extremely imperative to the pregnant person, but sometimes I feel like that burden for me is a little heavy, But yeah.
And I'm glad you brought that up because I've heard that as well too. And I think even myself, at one point, I didn't grow up knowing what a doula was. I've never seen a doula. I didn't know anybody who used a doula. And if I might have heard something about a doula, it was in like a movie or a book, and it was a white person that was talking about, a home birth and such. But I find that as people are moving more toward like the alternative medicines, alternative ways of doing things, we're hearing more about doulas, but I think there's a confusion in that the doula replaces, the medical doctor, and that you don't have to go see a doctor if you see a doula.
Yeah, I'm always screaming on social media, please learn the difference between a doula and a midwife. A midwife is a clinical professional. A doula is not. A lot of doulas, and I barely use the term doula anymore because it's known for one thing, right? Like now I call myself a birth worker because I'm a childbirth educator. I'm a breastfeeding peer counselor. If it's a home birth, I can assist a midwife in a home birth. So, no, we're not clinical. We're just there for informational support, educational support, physical support, and it's, don't get me wrong, I feel like it's just as important, but it's definitely not clinical.
So let me share for a minute my perspective about doulas. Doulas are very helpful in terms of reducing anxiety. And the first step to a healthy baby, to a healthy pregnancy, is your mindset. And what midwives and doulas do brilliantly, I think, is you create this space where the anxiety is reduced. And scientifically, if your anxiety is reduced, then that means that your adrenal glands are not going to be pumping, adrenaline, which then raises your blood pressure, which then gets transferred, from mom to the baby through the placenta. And then baby is feeling, experiencing mom's anxiety, and therefore experience, sometimes that translates into fetal distress. So what I would recommend, I don't know if y'all want to go this route. Unfortunately, in medicine, everything is about a study. It's scientific, evidence-based, blah, blah, yada, yada, yada. As Black people, we think a little bit differently. We focus on our faith and our intuition. And yes, is evidence-based medicine helpful? It is. But what I would recommend, if doulas want to, for lack of a better, if you want the greater recognition that you certainly deserve, then start doing some studies. Control versus non-control, because you are very, very important in terms of the birth space. Now, a lot of my colleagues, especially those that do not look like me, may not say that, but you do definitely make a difference.
I absolutely agree. And what you said about I always tell my clients that my job is to make sure you feel safe, because the moment that you don't feel safe, labor can literally stop. And then that's when we go into things like, let's have a C-section because of that diagnosis that everyone loves, failure to progress, right? And then you have to have a C-section, and it's not necessarily an emergency, but you've been laboring for 20 hours and the doctors want to go home. So as a doula, my job is to always make sure you have a safe space and you feel vulnerable enough to give you that strength to give birth.
So now I want to talk a little more about, signs and symptoms. I know we talked about things like hypertension and different issues that we might have pre-existing that can at some point maybe complicate the birthing process. But, I can only go back to when I was pregnant. And I think, Shani, I had shared this story with you. I was very young, and my water broke very, early. It was, I think my water broke at like maybe 26 weeks. And at that point, I had not even been to one birthing class at all. And so I knew nothing about what was supposed to happen. And now looking back, I remember the week prior at 25 weeks, something shifted in my belly. And it looks like, I guess, the baby was descending. Like there was a total shift. And I remember feeling so sick, but I didn't think to go to the doctor or the hospital because I didn't feel any pain. And then, a week later, water broke while I'm brushing my teeth. I go to one hospital. They say they can't help me. And then they shift me off to another hospital, which was not part of my doctor's network. So I had new doctors, knew everything, thinking I'm going to come home. And they're like, you got to stay here. And so had I known maybe what feelings, what symptoms, what signs, to alert me to say, hey, go see a medical professional, things might have been different. And the same goes for one of my other friends, unfortunately, who lost her baby at 5 months. She felt some changes in her body, but didn't address it because she didn't know that it was something to address, lost the baby. So I just want to kind of touch on that portion because it's really important. A lot of us really don't know. And like you said earlier, I believe, Dr. Burke, some of us, this is the first time you really go see maybe an OBGYN or a GYN is when you're pregnant. So what are some of these like signs and symptoms that we should be paying attention to if, we're pregnant or if we're thinking about becoming pregnant?
Okay, so can we move to before you become pregnant? Because I think this is very important. What I recommend is that if you're contemplating becoming pregnant, you make sure that your blood pressure is in check. Now, I recommend that everybody do this. When you get up in the morning, the first thing you want to do after you brush your teeth, yada, 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 take your blood pressure. Why? Because the hormones that wake us up are called catecholamines. And what those hormones do is they increase our blood pressure. So their role, they have many roles, but one of the roles is to wake us up, and the increase of these hormones, our blood pressures may be elevated. And I actually learned that from my cardiologist, who happens to look like me, because I didn't even know that. So that's the first thing that everybody should do, men, women. Take your blood pressure the first thing in the morning. And if the numbers are 130/80 or higher, you have stage 1 hypertension. And therefore, you need to be monitored and you need to be treated. Now, old school, quote, normal blood pressure was 120/80.
Mm-hmm.
The 80 is no longer normal. The 80 is abnormal. Not high enough to cause bodily harm, but it's a clue, it's a sign. And that is to be paid attention to. Second thing is, if you have a family history of diabetes, when you see your PCP, ask them to do a test called a hemoglobin A1C. And, I'll be more than happy, Ritha, you can, if any of this information, you want me to repeat, I can, email me and I'll write the information for you, right? Send it to you. But a hemoglobin A1C is a blood test that tells us how well controlled your blood sugar has been for the past 3 months. And if it is 6 or higher, that's a clue that, okay, I have a potential risk factor, of developing diabetes. Let me pull up, let me straighten out my diet and, exercise more. And these are preventative things. These are clues. Medicine is about looking at recognizing the clues that are going to tell you if we're going to have problems in the future.
Mm-hmm.
So, now you become pregnant. First thing you need to do is select the right person. I cannot say that enough. And once you've established, a relationship with a healthcare provider, a midwife or a physician, or OBGYN, doc, family medicine, then you need to now start looking at what risk factors do I have that I need to be aware of and make my physician or my healthcare professional aware of. And, I wrote a book called The Smart Mother's Guide to a Better Pregnancy. And these are the things that I had talked about. It's overdue for a second edition. But these are things in medicine that we call early warning signs. And these are the things that you really have to be very aware of. Back pain in pregnancy, people blow you off. Oh, you're pregnant. Your belly, the shape of your belly, your belly's getting bigger. The shape of your back is changing. Back pain is a potential sign of premature labor.
Mm-hmm.
And so if you have back pain that lasts for more than an hour, then somebody needs to put you on a monitor to make sure that you are not having contractions. Bleeding is another thing that you need to be very mindful of. If you are having bleeding during the first trimester, second, any bleeding during pregnancy is not normal, and that needs to be addressed. Headaches, especially in the postpartum period. If you have a headache, first of all, know your numbers, okay? If you hopefully start prenatal care in your first trimester, which is anywhere from 6 to 12 weeks, your baseline blood pressure numbers are important. Why? Because in the second trimester, and this is where my colleagues mess up, and I'm talking about OBGYN, I'm not talking about, I am talking about physicians. In the second trimester, just based on the cardiology, the physiology of our bodies, your blood pressure should be lowered than the first trimester. If it is not lowered, okay, if it's higher than what it was in your first trimester, that's a clue. That means that we have to really start watching your blood pressure very, very closely, because that is a risk factor for preeclampsia. The other thing that happens quite often is you go for a prenatal visit and your blood pressure is high, and then they repeat the value and it's low. It's lower than the initial high value, and so they say, okay, you're good. You're all right. Second reading was okay. No, that is not okay, because the first you're supposed to treat hypertension based on the highest reading. And that's where people mess up, miss the diagnosis of preeclampsia, and then everything turns sideways. So these are, some of the clues that you need to be aware of. And even if your physician misses it, you won't, because you're paying attention to the things that really matter that could adversely affect your pregnancy.
And I guess this is where the education part comes in, right? Knowing your numbers and having, doulas and other support systems that can, if you don't know, that can actually teach you. That if you are in a position like you're stating, Dr. Burke, that you can go back and say, well, actually, this is not my normal blood pressure. This is not my normal this. I know, Shawnee, you are in the healing space. And so, how do you move forward to educate women on understanding, what the signs and symptoms are, to be in tune with their body, so that they know at the moment that something feels off, that they need to get assistance?
Yeah, my take on this piece is holistic, in the sense that when Dr. Linden first said, pick the right person, I thought about intimate partner. I didn't just think about the physician or like the person that's providing the medical care. A lot of us don't do the necessary research, meaning talk to the partner about their own family history. When I first started doing the conferences, the Motherweight conference around this work, I had an embryologist that came and spoke to the community. And the breakthrough that he provided for the women in the space that had experienced multiple miscarriages was that sometimes, and our bodies are so magnificent as women, we just don't know, we haven't been taught. But sometimes the woman's body picks up that the sperm, or when they conceive, that there's something out of whack. That's my language. And the body will release the pregnancy. And I'm like, that's a good thing, that level of attunement with the biology of the pregnancy, not only your own, but the person that you've conceived with, that your body knows and will. And so when we had that event, women, I heard cries in the audience because so many women blame themselves when they miscarry. And miscarriages are common. And then also it can happen because your body is doing what it knows to do to care for itself. But we don't know that. We're not educated. The other piece is not only talk to the partner that you want to conceive with, or you might conceive with, because not all pregnancies are planned, that we need to be asking our mamas, grandmamas, and great grandmamas about their reproductive history. In my family, there is a history of postpartum depression and psychoses. But I didn't know that my mother had her 5 children, and after every child, she went through severe postpartum depression. My family just said, oh, that's just your mama. She's just crazy. She had a nervous breakdown. There's no such thing. But I'm 52 years old, and that's the language they used back then. And my mother never got treatment, never got supported, and she had back-to-back babies. The other piece is we have to look into our reproductive health. More of us have fibroids and PCOS, and I never heard of these things when I was younger. Part of it is because no one talks about it, right? These bleeding, and you're bleeding through multiple pads in an hour. We have issues of blood as Black and brown women, and we don't talk about those things. And then we are shocked when all of these developments happen. And one of them is infertility and issues around not being able to conceive or not being able to sustain a pregnancy. So my daughters, since they were young, the one that passed and also the one that is my still living daughter, I've been teaching them about their menstrual flow since they were young. We celebrated it. They knew what was happening. One had her period at 8, the other one had her period at 11. They knew what to expect. We have to have conversations. I'm speaking about prevention when they're very, very young, that every child that wants to become a mom may not be able to conceive. If you conceive, you may not carry that baby to term. If you carry the baby to term, they may not survive, because I know many women whose babies were born still, or families who experienced that. If their baby is born breathing, they may not make it to past the age of 1. These are conversations that we must normalize. And it's a shame that we have to, but this is what's happening. And we need to be in communication with each other about it so we can prevent women and their mates and their families from suffering unnecessarily. So that's how I approach the conversation, holistically and as a rite of passage.
Yeah, that's excellent. 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 And there are, for every condition that you mentioned, you are absolutely right. Quite often, we don't go that deep as physicians, but there is definitely scientific evidence that says that if there is an abnormal egg, or if there is an abnormal sperm, then the body is going to get rid of that. Quite often, women are sometimes pregnant. They have what we call chemical pregnancies, meaning that there was a fertilized egg, but something was wrong, and they had a period, thinking it was a regular period, and actually it was this abnormal embryo that was being discarded. So, I could not agree more with everything you said. Health is holistic, as well as physiologic. My personal, and I'm going to share my history because I think it's important. My personal history. I'm a descendant of 2 slave midwives. Okay, one born in 1822, one born in 1850. Both delivered babies on a plantation in Virginia. My grandmother, I never knew, because she died, like you mentioned, of cardiomyopathy after giving birth to my aunt, who was 9 months old at the time. Birth is it's a spiritual experience as well as a physical experience. And I can't talk like this in many settings, but everyone has a destiny. Okay. And when we lose a mother, when we lose a baby, we've lost a gift, because everyone has a gift. And quite often, the babies are quite intelligent. They know when it's time for them to be born. The problem is that we, as clinicians, miss the signs. And what is the sign? The sign could be all of a sudden everything's going well in terms of, your labor, and then all of a sudden the heart rate of the baby just drops, like boom. And that's not a good thing. And I have a philosophy of follow the mother, look at what the baby is doing. And if it's time, if the environment that the baby is in, the internal environment, is not supportive of its existence, then we have to make some decisions in terms of delivery. Many of my colleagues don't look at pregnancy that way, but I do. It is definitely a spiritual experience. The act of fertilization, the fact that you can have a sperm that's in a vagina that has to find its way, and I wrote about this in my book, that has to find its way to an egg that is outside of the vagina. Okay, fertilize, and then travel back into the uterus to develop. That's a miracle. So I just want to add that
I like
into the conversation.
I really like the way you broke that down, because I feel like, when you break it down like that, we're able to actually see the miracle in it, right? As opposed to, I got pregnant or somebody is pregnant. And I think it helps us see that passage as a rite of passage and as something that is a spiritual event as opposed to just a physical event. Now, I want to ask, we talk about postpartum depression. I do want to get into that a little bit, but I guess prepartum depression. I've heard that term as well too. And with respect to having, I guess prepartum depression or depression, prior to and mostly during your pregnancy, what effects can that have on, on the birthing process? Because we talk about hypertension, we talk about some of these other physical things, but what about the mental state? How does depression while pregnant? And it's not to say that you actually have a clinical diagnosis of bipolar, but you become depressed during your pregnancy, maybe for whatever reason. How does that play in part of the birthing process?
As someone who actually experienced perinatal depression that led to severe postpartum depression, it felt paralyzing and debilitating while I was pregnant. I did not enjoy the pregnancy. In fact, I say this jokingly, but because, like Dr. Linda said, the spiritual aspect of it is, like, I'm a metaphysician, so I always think about this. I didn't know it then because I was 21 when I had my second child, but my baby wanted out. You talk about smart babies. I was so depressed and depleted that baby came in the 7th month, my daughter Jasmine, because she is like, this is a hostile environment. I was miserable. And then because I had a traumatic birth experience and she had a birth defect and she had to get surgery and she was in the hospital for 30 days, it carried over beyond the pregnancy and it turned into severe postpartum depression and psychoses as a result. And nobody was asking me these questions. Are you okay? I looked listless and depleted, but nobody was inquiring about that or my mental state after going through such a traumatic birthing experience. It was like, oh, we flew your baby over here, go meet your baby there, and that's it. And we were young parents, my former husband and I. So I was a poster child for postpartum because of all the dynamics. We were in a military on a base, living there, away from family. We were young. I had, history of mental illness in my family, depression specifically, and bipolar. So I had all of the indicators to look out for, me during my pregnancy and after, but they missed it all because they didn't ask the questions. So for me, and it's different for different women, it was something that could have taken me out of here. Like I literally, after the birth, was considering taking my own life. And it's not something to play with, but we live in a society where it's skipped over. And I will say this last thing and then quiet myself because tomorrow I'm aware that you haven't spoken as much. That you said it at the top, Dr. Linda, like we work and work and work. It's like I got 4 jobs. I'm 9 months pregnant. I'm only going to be able to take off 6 weeks and then I got to jump back in and I got 2 other kids at home and I might not be with the partner. And I'm not trying to create a dark picture of Black women because we're awesome, we're dope, but it just doesn't work to have all of that going on. We need to have our feet rubbed and food cooked for us and taken care of, but we don't get that. We have to keep plugging away because of the social determinants of health, poor housing, inadequate employment, or being under earning and all of that stuff that makes life very difficult and it makes it hard on the body, mind, and spirit.
So Tamara, I do want to go to you with this because you're a doula. You're there to help with the mind, the spirit of these women who are embarking on their birthing journey. And so I want you to talk maybe a little bit about what your experience has been dealing with women who are going through this process with depression. So now we're not even going to postpartum yet, but they're going through. They're scared. I know we talked about this before. Women, somebody mentioned it in the chat. Women are scared. Black women are scared to get pregnant because they don't want to die. And I can say even for myself, that's why I have 1 kid because it was a very traumatic experience for me. And I had a C-section and they say that you have to have most likely we'll have another one. And so I'm afraid of all of these pulmonary embolisms and different things if I get cut open on the table again. So how do you deal with the women who who you work with on the day-to-day, who are expressing these types of concerns, who are already anxious? How do you get them to a place where they can calm down a little bit and really enjoy their birthing process?
Okay, so I think two things, right? When you're choosing a doula, you want to choose someone. I always say, if you don't see me as a friend, then we're not meant to work together, right? And I've told clients that, potential clients, like, I don't think we're a right fit or whatever. And why I say that is because I think I've had a client where, because we created this relationship where, she felt safe enough to talk to me, I could pick up on things like, I think you're a little depressed, or I think, are you suffering from anxiety, or things like that. But it sits on the fact that we created this relationship, right? Because sometimes a lot of the women that I work with don't necessarily have a partner, or they're going through pregnancy alone, and they're going through a lot of things alone. Or I have a client where her family is in another state and she's in Brooklyn, and she's doing this pretty much all on her own. And it's not to say that she doesn't have a supportive family, but she's on her own for the most part. And having a doula kind of lifts that weight off of her, and she feels safe enough to talk. And sometimes for me as a doula, I have to pick up on those signs, or pick up on her mannerisms, and pick up on just certain little things that she'll say, or certain little things that she'll do. And so I guess that's how I'm doing it. But I wanted to say, and I haven't shared this a lot, I don't know if you guys saw my son passing by, but he's gonna be 11 this year. And I had him literally right after college. I think I was like 22 or 23. I got pregnant at 22, had him at 23. And I didn't know till I became a doula, which has only been about 4 or 5 years, that I suffered from perinatal mood and anxiety. And crazy. I remember I didn't want to hurt myself, in the sense that I didn't want to live, because I knew I wanted to live, and I knew like I had to live for this baby. But cutting became very interesting to me. And so I would test it out on my lap, on my thigh, so that no one would see it, right? Because my belly was getting bigger and no one could see down there. So and I didn't, and then to back to what we were talking about pregnancy being spiritual. I mean, long story short, I think that it was completely God and nothing to do with me. But I remember saying, I don't want to do this anymore. I don't want to live like this. I don't want to hurt myself. And it took a couple of months, but I was having migraines every day. My blood pressure was fine. Everything was fine, but I couldn't get rid of these migraines. I couldn't get rid of back pain, but there were no signs of anything else. Baby was healthy, and for the most part, I was healthy. So I remember just saying, I can't do this anymore. And I think like by the 3rd trimester, everything went away. Every time, and because I gave birth 11 years ago, there was nothing online. Like, I did not know about a doula. I did not know anything, but I remember finding an article about letting go of all those things that you're holding on to, that are probably keeping you in this place of depression. And I remember I saved the article, I bookmarked it and everything. And I remember like writing a letter to family and just letting them know that I'm stressed, I can't deal with this. And I did not know anything about therapy. I knew nothing, but I knew that if I wrote this and I sent it in emails, and to be honest, I felt much better, because I said I wanted to give birth much lighter, and I wanted to like not have I didn't want to carry that into labor. So I think a couple of weeks before I gave birth, I wrote all of that, and all of that weight was lifted. I know everyone's story is definitely different, and if you need medication, if you need whatever you need, you get the help that you need. But yeah, that was my story.
Yeah, behavioral health is thank God, becoming more acceptable. Everyone has a different experience, and what women have to understand is your hormones are extremely different once you become pregnant. Like everything, you have your pre-pregnancy hormonal level, but then once you become pregnant, because the body now understands, okay, I've got to maintain this pregnancy. So the hormone that maintains a pregnancy that prevents you from having a miscarriage called progesterone, that increases, estrogen increases, and then at the end of the pregnancy, it decreases. So there's like this roller coaster ride going on in terms of your hormones. And you really need to understand what's happening and to get professional help. Now, the good thing in this generation that was different from when I started training is we now have, we now have telehealth. We now have virtual visits so that if you need some help, it's easier to get it, even if it's online, than it was back in the day. And the other thing that's very good is that most insurance plans, including Medicaid, will pay for behavioral health counseling. And so this is one of the other things that I think we as physicians can do a better job of exploring what's going on, with the patient, and then making sure that they get hooked up with behavioral health. Now, my background is a little bit different because, Shani, like you, I was a social worker before I became a physician. So I look at, patients from a whole different perspective than many of my colleagues do. But, and I'm not disrespecting anyone else's race, but Black women, this is what we mean by being culturally competent, because we live in the same skin as our patients. And so we're more attuned to things that could be going on, in the home that might be affecting the mental health of a patient. And all of that is very important. The mental health is extremely important.
So now I want to ask, because I know a lot of people have asked me this, and I'm looking through the chats and I've seen sprinkles of this in terms of the advocacy portion, right? Because we know that there is an issue, right? We know that it's not just racism, and I know Dr. Burke, we talked about this over the phone. It's not just the racist aspect. There's an economic aspect as well too. Where capitalism is at its finest when it comes to medicine and things of that nature, right? But advocacy is something that we keep hearing people say we got to advocate for themselves. And even with Serena, she knew some words, she knew she had some of the lingo down pat. But how can we, as and I would say everyday women, everyday Black women who are living in these communities, going to these facilities, seeing doctors that do not look like us, how can we effectively advocate for ourselves in these settings?
Yeah, so I plan to teach courses about this, actually, about the whole hospital space. And this is going to sound a little weird, but if you are experiencing treatment that you're not satisfied with, and if it's in the hospital, you ask to speak to the nurse in charge. And you tell her or him that you're going to file a formal complaint based on A, B, C, D, E. So let me give you some, let's say you present to the hospital, let's say labor and delivery, because you're having, your 27 weeks, you're having contractions, blah, blah, yada, yada, yada. And the physician never sees you, he or she is calling, speaking to the nurse, and the nurse is providing the information. That's wrong. That's wrong, because the physician or even the midwife is going to make a clinical decision and he or she has never seen you before. So don't allow that to happen. Don't allow anybody to send you home in the middle of the night, like 2 o'clock in the morning. Oh, we monitored your contractions. You're good, blah, blah, blah. Do not go home. Okay. Because that is a scenario where things can happen. If you see behavior that you feel is offensive, number one, never walk into a hospital without somebody being with you. I don't even do that. Always make sure that you have another person that can, be it good or bad, that you are receiving. And if the treatment is not to your liking, make a formal complaint to a nurse manager. The other person you need to speak to is the risk manager, because they're in charge of all of, the quote, potential liability problems. Mm-hmm. The other thing that I would strongly recommend, pull out your phone and start live streaming the behavior that you are witnessing that makes you uncomfortable, because people have to be accountable for the things that they do. Mm-hmm. I'm not even going to go into, there's a whole lot going on in from an African American physician's perspective. People filing lawsuits based on medical racism. Dr. Susan Moore dying, and on her, and I'm trying not to get emotional. A few days before dying, she has to pull out her cell phone and document the mistreatment that she's receiving. I mean, this is the space that we are in now. And so therefore, in terms of advocacy, there are supposed to be so-called ombudsmen that are supposed to handle it. Worst case scenario, push comes to shove, call the media. And you tell them, I'm calling the media first, and then I'm calling my attorney, even if you don't have one, okay? Because you want everything to be on record that you are dissatisfied. All these little surveys that people, send, did you like our treatment, blah, 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 blah. That's your weapon. That's your weapon of empowerment. Because if hospitals don't receive, quote, favorable surveys, that affects their money. Because Medicare pays based on performance. So if the performance is not satisfactory, then that's money in their pocket. This is the times that we are living in. It is a business. Mm-hmm. I'm gonna stop because
I think sometimes what I see are my clients are scared, right? They're scared that they're going to get bad service if they act like they're at a restaurant. If I yell at this waitress, they're going to spit in my food. No, it's completely okay. You can ask if you don't like the attending that's over your birth, you can definitely ask for a new one without fear of reprisal from the hospital or the clinicians. So just in terms of advocacy, it's a very hard place for me because a doula is taught to teach their clients to advocate for them. And a lot of times I find myself advocating for them, which is my job too. But sometimes it just helps if I advocate for them also. And that is my job. But a lot of times the focus should be for the client themselves, the pregnant person themselves, to advocate for themselves. It's important to go in there with the partner because, again, if a woman is going through labor, she's not in a place where she can completely advocate for herself. So having her partner there, having her mom there, a friend there, just someone that loves and supports her there, partnering with the doula to advocate for that person, because you cannot do it on your own. A doctor's appointment, whatever it is, I just wanted to just, say what you said again. It's so important to not go to the hospital by yourself at all for any reason.
But also be respectful, and here's the thing. I mean, you know, it's cultural. We're emotional, you know, and I have been labeled, quite often, and back in the day, an angry Black woman. And yeah, I was angry for a multitude of reasons, but you want to stay away from the space where people are going to label you, because then they're going to focus on your behavior rather than your complaint. So this is why it's important to have a partner with you, someone, who could articulate, who could talk about your complaints. Because, if you're feeling pain, you cannot do that. And we should not expect, a pregnant, laboring woman or anybody who's in a hospital bed to have to advocate for themselves. That's like an epic fail. But be respectful, but know the rules of engagement. The other thing I want to mention is that there is a high-risk OB specialist called a maternal fetal medicine specialist. And do your research, see if they have that service in the hospital that you're in. Most hospitals do, some in rural areas don't. But even in the rural areas now, because of telemedicine, they can do video consultations. But if you are not satisfied with the clinical treatment that you're, and behavioral treatment, if you're not satisfied with if you have questions about, am I receiving the right treatment, ask for a consult with a maternal fetal medicine specialist. And the other thing is, do not, if you present to the emergency room, especially, if you've had a baby, do not leave that emergency room until an OBGYN physician has evaluated you, because this is one of the main reasons why women die, because they're not seen in the ER by an OBGYN. They are seen by emergency physicians, and then inappropriately sent home, only to come back with major problems or even regretfully die when they go home. So that's another thing in terms of advocacy.
Now, Shani, you have a movement institute. You're working with women. You're a Black maternal health advocate. What are you telling women in terms of how to advocate for themselves, throughout their working journey?
Sure. So there's a couple of things that I will share, and Dr. Linda gave statistics on the number of physicians of color, Black physicians, Black and brown physicians. And when I think about midwives, just thinking about my own daughter, that because there's so few midwives, you talk about physicians, there's even less midwives, as we said earlier. I caution families about running to the midwife that looks like them, and not thinking about whether that person is oversaturated with clients, with patients, because they may be stellar at what they do, just like I'm great at what I do. I'm attentive, I'm present, I have a lot of experience, but when I am extremely tired and worn down, you don't get the best of me. And we don't have enough in the field, and they get inundated with requests, and of course they want to keep their businesses up and things like that. But we have to be mindful of that, because if there's not enough, then everybody is going, and then something about the care doesn't land. And I love that we have them. We just need more of them. The other piece is, we will research a song, we will look for a recipe, but we will not do the adequate research for the hospital or the physician or the folks that are taking care of us. And so we need to look for reviews. How many C-sections, or do they have a high statistical rate around C-sections in this facility? And if that's the case, I would side-eye the facility. It's like, oh, they're all for getting you in and out. It's like a factory. And because we've medicalized giving birth, like it was already said, it's like a machine. It's like, okay, mom is staying too long, she's not progressing, let's give some Pitocin, let's speed this up. Oh, she's still not progressing, let's give her a C-section, and then we can clear this bed, move her along, and then move the next mama in, so we can do that. And surgery costs more than just pushing the baby out. So just being mindful, being accountable, be responsible. this is an emotional time, but being driven only by your emotions doesn't work. And trust, because I am a spiritual person and a healer higher than any educational degree that I have. Trust your intuition when it's speaking to you. Listen, because my intuition has saved my life many days. And I think a pregnant woman is even more intuitive. Got the baby's energy and yours combined to save your life. And what I'll finally say, and it's already been said by Tamar and Dr. Linda, is that you need a birth crew, a tribe. It's a rite of passage. I run rite of passage programs. We do things as a collective. So shop amongst your friends about who's going to be the right midwife or physician that's going to care for you. And then also go with your tribe when you're doing what you need to do to care for yourself, and make sure you're reporting back out so some other voices are in the conversation. So I'm complete, and I'm so grateful for this conversation.
Okay. Yeah, no, I'm really grateful for this conversation as well too, because I mean, so many women, so many Black women, you know, we have these conversations in silos, like we're in our chat groups and we're talking about these things, but we're still very confused, right? We still are not empowered with the information, and a lot of us have, you know, are in our childbearing years, and you know, and again, Shawnee, I know we talked about this, just this idea of, I don't know if I want to have kids, not because I don't think I can be a good mother, but because I don't want to die. You know, I don't hear my white counterparts having the same conversations. I've never heard that come out of any of their mouths, but routinely it comes out of our mouths. And with this Black maternal health crisis that's going on, and I think that's been exacerbated with, you know, the coronavirus even, we really want to just raise awareness, because it's emotional. I know everybody on this platform has their personal stories, and you know, especially with the clinicians and the doulas, you guys have seen it with your own eyes. And even just talking about this, I'm reliving my own experience, and it's bringing back my personal fear of, wow, if I have a C-section, I'm probably gonna, I don't know, maybe I might die. We need to do something about this. We need to be able to shift the narrative. We need to be able to take back our power as women, and kind of bring it back to the spiritual process that it once was and still is. But you know, but due to the medicalization of births and things like that, you know, we're kind of losing sight of that. So many are asking, is there hope for a better maternal health process when it comes to Black women? Like, is there a way to eradicate this public health crisis? Will there be a day where we will say, when we no longer need to raise awareness for Black maternal health?
Yeah. So let me go back for a minute. You know, putting my spiritual hat on. Fear is your enemy and faith is your friend. And I know that it may sound like words, but the mindset is everything. We have to have faith that there is something greater than ourselves that is going to guide us and protect us. Because I'm a witness, and I think we all are. Now, the problem, it's multifactorial. The issue is we need more people who look like us. Okay, that's the battle I'm fighting now in terms of medical schools, admitting people, who look like us. What I want mothers and fathers to do is to expose their children at the earliest age possible to science, technology, engineering, and math, STEM, because it starts early. And the sooner that we are exposed to these specialties, the sciences that normally we kind of shy away from, the more people we will have to fill these gaps. We are, as Black physicians, Black midwives, we are here. And even though there are not enough of us, we are still here. And we're not going to let anything happen to you if we know where you are. I mean, I'm thinking totally out of the box now. You know, I've developed an app. Somebody stole the idea, you know, it's out there in the space now, you know, making they raised $70 million, you know, off of my creativity. But that taught me a lesson because it taught me how bad blank I am. Okay. and I didn't own it before. Okay. So everyone who is listening, you know, the fact that you're here means that you were led here. And even though things look dire and ugly, we as a people, despite everything that we have gone through, we're still here. Despite everything that the Native Americans have gone through, they are still here. So what I want y'all to do is focus on just like Shani said, do your due diligence. If you are looking for a physician, seek out one that's going to make you comfortable. You know, and I'm not telling you what race to look for, but just do your due diligence. And also, let me also say this, that your health plans, your insurance companies, they have an obligation to protect you. Okay? Because you're paying the bill because you're paying for your insurance. And if if you receive Medicaid, then that means that, you know, the tax money is paying for your insurance. Somebody's paying the bill. Make them earn their money. You know, call up health plans if you're not happy and express what your concerns are, because it's their job to make sure, just like it's my job to make sure that you have a good outcome, it's their job as well. So I don't know if that, answers the question, but face the challenge with faith and not fear. Because, I can tell you, I'm not going to waste anybody's time, but I am a witness that fear is your worst enemy. Don't approach things from a position of fear. Approach things from a position of power, because you do have the power. It's in your DNA.
I like that. Tamar?
I mean, I completely agree. You know, it's kind of like asking, is racism going to end, right? And I think for me as a doula, my favorite part of this whole thing is education and talking to families, and so much so that I actually stopped doing labor support this year, and I'm gonna move forward in just like fertility. And we had conversation about intuition, about reproductive health. Like that is my zone of genius. You know, I've dealt with period health. I'm dealing with period health. And that's where I find that women need help. You know, the conversation needs to start way before pregnancy. My son, a boy, knows where babies come from. You know, these conversations need to happen so much earlier. You know, they need to understand their bodies. They need to understand, and one thing that this reminds me of, I always say, listen to your body, but I'm telling you to listen to your body when you're pregnant. And I felt like that's too late, because they don't know how to listen to their bodies. They don't know how their cycle works. They don't know, when they're ovulating or when their period is coming, because they've been on birth control for the past 10 years and they don't know what anything feels like, So for me, I think that having the conversation and arming yourself with the education and going on a holistic healing journey is important way before pregnancy comes to play. Sure, yes, pregnancy comes up like magic sometimes, but having that conversation before and really sitting with someone like myself to talk about your reproductive health, to talk about your womb health, to talk about, anything that has to do with healing your body spiritually, emotionally, physically should definitely happen, because that will help you come into birth with a better mindset, so yeah.
And Shani, any comments with respect to, I guess, where do you see this Black maternal health crisis landing? Can we get over this?
I absolutely believe we can. And if you're not comfortable with being uncomfortable, we won't make a difference. It's not about being comfortable at all. This is about being shook at the core and then taking that energy and synergizing it so that we make a difference. Like, revolutions don't get created because we're sitting comfy on a couch. This COVID actually for me was an awakening, not just from the low vibration, because I lost many people on this journey, but from the high vibration of clarity. All of us sitting still, watching them choke out George Floyd and kill him off, and just watching the dynamics play out, watching all these folks climbing the walls of the Capitol. Like, COVID, even the playing field on many levels in reference to work and just all of this stuff. Folks who were just like, it's not that bad, that are Black or brown and white, because some of us say the same thing, just got really present to how this can go and the realities of the inequities as far as health, employment, the haves, the have-nots. People are waking up. And in that wokeness, we could be worried about the wrong thing, but I'm inviting you to think about the fact that how we all got here, and what we all have in common is that a womb housed us, whether it was for 9 months or you were overdue or you came early, you got here, you're still breathing because a womb housed us. And so all of us need to be in this conversation about reproductive health, and it's been put on the backs of women to carry this forward. Brothers are in this conversation because you co-create with us, and you got here in the womb of a woman. And so what has been moving for me, my daughter's mate is now a content expert around maternal health and Black maternal health and maternal morbidity and mortality. And that happened as a result of my daughter's, actually, he was in the conversation already, but it got amplified because my daughter passed. And people will show up and listen to him more than they can show up and listen to me, because people want to hear what Black and brown brothers have to say. So more brothers need to speak up and speak out and be rubbing the backs and the feet and catching the babies, so that we can actually survive this thing and actually on the other side thrive. So yes, I do believe that it can be turned around.
Because knowledge is power.
Absolutely.
And so that's what you have to attain. This is a wake-up call, because you need to know what's going on, because, I'm just going to say something, and it might be a little controversial, but you have the ability to save your life. Okay. You have the ability to save your life if you are in tune going on, and if you obtain the knowledge, because it's power. That's your power. Your knowledge is your power. Not leaning on someone else's information or perception, but getting your own.
Yeah, I absolutely agree with that. And that's one thing I will say that, with our platform, we're trying to do. We're trying to challenge people to think critically, because I think that as Black people, unfortunately, and this, could be conditioning, right, from just going through the education system, is that we're not challenged to think critically. It's so easy for us to go off somebody else's research, or somebody else said this, or to allow certain things to happen without doing the due diligence that each of you have talked about. With something as sacred as birth, right? You would think that we would want to be, in the know, but unfortunately there's so many barriers sometimes to even accessing that information. But I'm really happy that we were able to have this conversation. I thank you all for being part of this panel discussion. I mean, I'm looking at some of the comments. I have friends who are texting me on the side, and the information that they've just gotten just from this This conversation tonight is definitely, I think, changing lives and having people rethink, this Black maternity crisis, right? And I love the fact that all of you are so hopeful about the outcome of this, and you're not just like, well, we're just gonna have to deal with it.
No, not at all. No, none of the above. No, no, no. Things are happening. Change. You don't see change as it occurs. You see the result of it. So trust me, things are definitely moving. And let me tell you why. In addition to all the things that we, discussed, from a PR perspective, this country, and I know you've heard the statistics over and over again, most industrialized country, worse maternal outcomes, and numbers are rising in terms of maternal health. That is a global embarrassment. Okay. That's why your congressman, without going into a bunch of details, I was on a virtual meeting, with congressmen and senators and yada, 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 blah, blah, blah. And the reason that they are supporting, you have bipartisan support, because it is an embarrassment that the richest country in the world has the highest rate of pregnant women dying. So trust me, things are going to change.
Yeah.
They're going to change. They are changing. Let me put it that way. They are changing as we speak.
So we definitely want to continue these conversations because we touched on so many things, but as I'm asking questions, I'm like, man, this can be a whole segment in and of itself. I definitely want to have you all back to talk about, we didn't really go in too deep with postpartum depression because I feel like that is probably a segment by itself, because there's so many issues that present itself with that topic. So I definitely want to have you all back for a part 2 or a part 3. Some people have asked for a part 2 already. So I definitely want to have you guys back to talk about these issues, but more focused and more in depth, just so that we can give it the time that it deserves. But I'm again so grateful for you guys. You guys took time out of your schedule, and with Shawnee and Dr. Burke, I've never met you in person. So the fact that you had so much, I guess some faith or whatever it was to even come on this platform and share your expertise, I truly appreciate that.
My pleasure.
So with everyone here, thank you so much for tuning in to Black Maternal Health Matters, presented by Black Ivy Media. I see that we've had some strong viewers that have not left the camp. So thank you so much for tuning in. This is the first step of changing the narrative. It's this first step of raising awareness, just being here, learning this information. And I hope that you guys share it with your friends, your family, and anybody who will listen. Thank you for supporting us. Follow us on Instagram at Black Ivy Media. This actual recording will be available in the next coming days on our YouTube channel. So for those who missed it or came in halfway, we'll definitely have this posted so you guys can share it. Because I think that this is an educational tool that can be used because of the amount of information that we got and the different perspectives, the medical, the holistic. So I think it was a very well-rounded conversation. And so we are going to continue this conversation on the Clubhouse platform tonight. For those of you who do have Clubhouse, at 9 p.m., we're going to kind of do an extended conversation for those who weren't able to really join, or those who want to kind of continue and maybe even share their personal experiences about this. We're going to be on the Clubhouse platform. You can follow us there at Black Ivy Media. If you have any questions as to, again, who we are, what we do, you can also visit us on our website at www.blackivymedia.com. We are going to be putting on these types of panels. We're trying to do it more than once a quarter, but at least once a quarter, because we want to make sure that we get things right. But again, thank you to everyone who tuned in. Thank you so much to the panelists. I'm really inspired. I feel like I've always wanted to move forward in this work, but just listening to you all share and the passion that you guys have for it, I'm definitely inspired. And I think that I speak for many people on who are tuning in right now too, that they're even more inspired to move forward with this. All right.
Someone did ask to post contact and or book details, so I'm not sure if they're referring to everyone, or I know Dr. Linda, you said you had a book. What was the name of it?
It's The Smart Mother's Guide to a Better Pregnancy, and my website is www.smartmothersguide.com.
Okay.
And I'll also have that information available for those of you who are following again at Black Ivy Media. Dr. Linda's profile was posted on our page, so you can also find the bios of all of the panelists on the Black Ivy Media page as well. So if you have any questions, you could definitely follow them. I encourage you all to follow them and learn more about the work that they're doing. And with that being said, everyone, have a good night and stay connected.
Bye.